Okay, good morning, everybody. I think we're going to go ahead and get started. Welcome to our speakers, to the members of the press, and to those joining us on the live stream this morning. My name is Mike Wishney. I'm a professor at Yale Law School, where I co-supervise the Worker and Immigrant Rights Advocacy Clinic. Our clinic in 1199 New England are proud to release the first comprehensive report on nursing homes in Connecticut during the pandemic that centers the experiences of the workers. As we get closer to a potential May 14th strike date in Connecticut, it's critical that the public understand the enormous sacrifices and the lived experience of nursing home workers over the past year. Today, we'll hear from nursing home workers, union leaders, elected officials, and one of the students who helped to research and draft the report that we issued today. To begin, we'll hear first from Senator Saad Anwar. Senator Anwar.
Good morning, everyone. Again, I'm honored to stand with all the people who have been part of this report, but also the workers who have been taking care of our seniors in our community who've been doing heroic work. I've had the opportunity to read this report, and I'm sad to say I was not surprised. The reason is that I have been listening to the workers for the past 12 months or so. The fact that each and every aspect of their concerns that they had shared have been proven in this report. The sad part about the report is that while we have seen majority of the people who have died in the state of Connecticut from COVID being in long-term care facilities, we have not necessarily addressed the issues going forward. So it's almost like the 12 months or so have not trained us to be better prepared. And that is where we have a lot of work to do. Again, the fact that our workers did not have PPEs, the fact that our workers did not have testing, there were no guidelines, there was no prevention strategies for infection, there were no infection control strategies, the ratios of our staff was not the way it needs to be. A lot of those challenges that people have explained directly multiple times have been unheard. I'm hoping that with more data and with this report, we would be able to get the attention of all decision makers, whether at the legislative, but also at the executive branch of the government, so that we can join hands and make sure that we have learned and all the lives that were not lost in vain. We have to move forward, have a preventive strategy, and have a comprehensive way of fixing the challenges that we have seen historically and then currently, and then hopefully the future will be better. So I stand with all of you today to make sure that we highlight these issues. And again, thank the Yale Clinic, but also the SEIU for their clear leadership in helping protect our senior citizens and the most vulnerable citizens in our state. Thank you so much for having me.
Thank you very much, Senator Anwar, and thank you for your leadership as well. We'll turn now to Senator Jorge Cabrera, I believe is with us.
Good morning, everyone. Thank you so much for putting this together and for including me. You know, I've been talking to some workers at Arden House and other places about the work that you all have been doing that is so critical. And it's really frustrating to me, and I know it's frustrating to many other people, that in the middle of this pandemic, while so much of the work that you've done has gone unseen and unappreciated, how critical it is to make sure that in the state of Connecticut, we value the work that's been done during this pandemic. So many people have taken so many risks. I know many people have been lost. I know people have been infected, have struggled through COVID. And, you know, one of my challenges and one of my frustrations is that we've gotten to a point in the middle of this pandemic where we've called workers heroes and have really elevated their status in terms of our public shows of appreciation for them. And I really think that's important. But more important than that is that we not only have public displays of gratitude, but that we actually demonstrate that through public policy, that we actually put our money where our mouths are, and that we actually support the work that so many of you do day in and day out. And that's why I'm glad to be here. I know that you can count on me, and Senator Arwan and I have talked about this a lot, his experience as an emergency room physician. Him and I have had a chance to talk many times about what people are going through. And it is really, really important that we not just talk about our heroes, but treat them like heroes. And that means we put out good public policy, make sure we're funding those places well, and make sure people are getting paid well, that they have a living wage, that they have an ability to support their families, and that we pay them the money that they deserve. Quite frankly, they deserve more after what they've been through and the risks that they've been taking and the people that have lost and all the things that they've been through that are so traumatic. One of my concerns, and we begin to address this in the Senate with the passage of SB 2, which Senator Anwar was a leader on, is the invisible scars, the things that we know are coming, that are already here, quite frankly, the mental health issues that we're going to be dealing with for many years to come because of this pandemic. So count on me to work with all of you and to do whatever we can in the legislature to make sure that you all have the support and the funding that you need. And I'm really happy that you're standing up today. I'm really happy and proud that you've allowed me to be a part of it. And please know you can count on me to fight by your side and make sure that you get the respect and the dignity that you deserve all for all the hard work you've done.
Thank you very much, Senator Cabrera. That's a perfect segue, I think, to the first of the workers who we'll hear from directly now. I would invite Tanya Beckford, a CNA and an 1199 member, to speak now.
Thank you guys so much for all your support. I am just about getting to know each of you, but I know Senator Anwar much more. So hello to all of you and thank you for your time. And we're just so tired right now. We have exhausted all energy to try and get the governor to understand what this fight is about. We do not want to do a strike right now because we know that we're leaving our residents behind. And I have been having conversation with my family members and with my residents just to try and get them to understand a little bit about that it's nothing that we're doing that we want to do to hurt them. Everything we want to do is to make sure that they're getting the best quality of care because that's what they deserve and that's what they're paying for. As for us, we are just so tired right now. It's just so exhausting every single day to go in there and having to take care of 15 to 17 residents. And I work on an Alzheimer's unit. So it's more extreme because, you have to do just about everything 2 times on the Alzheimer's unit just to make sure that they're safe and secure. And we're asking this governor because obviously he's not hearing what we're saying. And we thank you guys for standing with us so that somebody could get through to this governor to make him understand that if he does not give us the funding that we need for the nursing home, everything is going to fall apart because why would someone want to come into a nursing home and work for that little wages when they could go, like I said, over and over to a McDonald's or do a Uber drive and make the same amount of money with less stress. A lot of us are getting hurt in there. We are burnt out. By the time we get home to our families, we serve no purpose because the only thing we could do is just go to sleep because we're just that exhausted. And, we're just tired of these people that's in charge of these nursing homes not doing their jobs because you're forcing us, I say it over and over, to abuse. This is how we look at it. We're abusing the resident because we cannot give them the type of care that they deserve. They work so hard and made it all the way to this time in their life that, they should get the best care, but we're struggling to feed 17 people in the short amount of time that you have to do breakfast and then prepare for lunch. We cannot do it. It's not that we don't want to do it. We are abusing the residents in our eyesight because we're not given the type of care that they deserve, and we're getting hurt. So I asked this governor one more time to please put money into his budget to fund the nursing home, that we could get the better wages and we could get the more staffing, so we don't have so much people, so that we can give the care to them. And as for me, I am recovering from COVID now. I had it when it just came into Connecticut, and I was out of work for 7 months. So the insurance is very important to me, because to this day, I'm still getting treatments for my lungs. It's still developing properly. It's getting better, but there's a lot of things that I've developed with the COVID that nearly killed me. And I am thankful to God that I am here, especially seeing Mother's Day yesterday with my new grandson. So I'm just asking this governor, please, and I'm asking you guys to please help us. And thank you guys for listening to all that we say, that he will understand that this strike is going to be on him, on his conscience, because we don't want to do it, but he's given us no choice. Thank you guys for listening.
Thank you, Ms. Beckford, for your powerful words. I will now invite Glenn Andrus, a dietary worker and 1199 member, who is among those on the May 14th strike deadline now. Glenn, I think you have to unmute yourself.
There we go. Sorry about that. How is everyone today? I'm very thankful to be here and speak to everyone. I hope that our politicians listen, because this is a tragic story that unfolded here in Connecticut. The TPH is not innocent. They gave little or no guidance. Dr. Gifford, I have no confidence. By 175, it was like my whole neighborhood was killed. It was absolutely tragic. It should have never happened. I got back to work 1 week later. They started laying off the heroes. You know, it's what it is to be a hero, because I don't want to be a hero if I need to lose my job after I just dollars for a bonus as CEO of Genesis, as almost 1,800 people die under his watch. What is wrong with this? It is absolutely tragic. The stress and the lives that have been ruined because of greed and neglect. The federal government also. Believe me, this was bound to happen in a system so full of cracks. They've just been ignored. Well, guess what? Time's over. We can't ignore it anymore. What are we supposed to do now? I make a plea to the legislators of this state and to the governor. Help fix this system. The residents deserve it, and so do the people that take care of them. We care. That's why we go to work. That's why the CEOs, I didn't see them in the hallways. As we died, I didn't see one of them. You couldn't even get a diminishment but not go to the COVID unit. As the rest of us, we don't have that choice. We have to take these chances. Somebody has to take care of them, and it doesn't seem like the people making all the money are doing all the taking care of. Thank you.
Thank you very much, Mr. Andrus. We'll turn now to Jesse Martin, Vice President of the Nursing Home Division for 1199 New England. Jesse?
Hi, thank you. Look, I work on behalf of 7,000 nursing home workers in the state. And this report, which was put together with the expertise and really the thoughtfulness of the Yale law students, is quite powerful. You know, I've spent the last year talking to nursing home workers about their struggles with this virus at their workplace and at home. You know, we've lost 16 nursing home members who contracted the virus and died, and many workers that we represent and non-union nursing home workers brought this virus home. This report highlights their collective experience of what happened in these facilities and at work and at their homes. and how their collective experience has impacted them as caregivers, and how the long-term care system in nursing homes is broken. I think the title is quite fitting. We were abandoned. Throughout March, April, May, June, even February of this year, even this week, I've gotten phone calls from nursing home workers that are struggling to get the proper protective equipment, to even have soap to wash their hands. And the policy and reviews that this report gives credence to the collective experience of tens of thousands of Connecticut citizens that work, live, or have family members in nursing homes from COVID. And workers in particular, the stories and quotes in this report echo what our organization has been fighting about for the last year, that nursing home workers need to be recognized for their sacrifices, need to be put in a position where they live a life outside of poverty, that the residents they care for are directly impacted by the quality of jobs that the caregivers have and how the caregivers are treated. When you have someone in the Department of Public Health state publicly that workers choose to work in trash bags, whereas this report finds through state documents that that same nursing home did not have appropriate access to PPE. It's unfortunate that we have to go to the extent of validating the experiences of nursing home workers. And I'm glad we did. Far too much the experience of nursing home workers and the residents that they care for are ignored because the overwhelming majority of caregivers are women, Black, brown, and white working class women, and the system of systemic racism and the Medicaid system and the Department of Public Health oversight on nursing homes has led to this crisis. 4,500 Connecticut citizens have lost their lives. And this report clearly shows the correlations between how state regulators treated those issues and also how staffing and other factors exacerbated the terrible virus that ravaged these nursing homes. So with that being said, later today, the union is going to be prepared to send additional strike notices for an additional 6 nursing homes across the state of Connecticut. And that strike will start on May 28th at 6 a.m. And those votes were overwhelmingly in favor of going on strike at those additional 6 nursing homes. That means a total of 39 nursing homes and over 4,000 nursing home workers have set a deadline for their companies and for the state to take us seriously. And we appreciate the work that the students and the Yale Law School have put towards codifying the experiences of our members and the residents. And we are hopeful that this document will be used by our partners in the legislature to look for reforms that are much desperately needed to make the change that the residents and the workers deserve. Thank you.
Thank you very much, Jesse. We will hear finally from one of the students who researched and drafted the report, Aaron Bryce Lee, and after that, we'll be open for questions. Aaron.
Good morning, everyone. Thank you so much again to Tanya and Glenn. Good to hear from y'all again. I hope everyone's weeks are starting off well. My name is Aaron Bryce Lee, and I'm a law student intern with the Worker and Immigrant Rights Advocacy Clinic at Yale Law School. We're very proud to be releasing this report together with 1199. When we started our research process several months ago, our goal was to make sure that the perspective of nursing home workers was heard. As we had conversations with 1199 members, CNAs, nurses, dietary workers, what struck our team the most was their tremendous commitment to caring for their residents. The staff treat their residents as if they were their own family. These workers risk their lives and the lives of their loved ones back home to care for these residents in unsafe conditions and for low pay. We thought it was important to combine firsthand worker accounts with a systematic analysis of publicly available inspection documents from the Connecticut Department of Public Health. Today, I want to highlight 3 major conclusions from our study. First, DPH documents corroborate the testimony of nursing home workers and union members who have been speaking out throughout the pandemic about understaffing, unsafe conditions, and inadequate pay. Workers raised the alarm about a lack of PPE and even being denied PPE by their facilities. They talked about how unsafe staffing meant that one CNA would have to care for up to 25 residents at once. We found that DPH inspection report documents confirmed these accounts. It's critically important that we listen to nursing home staff. They've been the ones on the front lines of this pandemic since day one. Second, the state didn't do enough to keep workers and residents safe. For 170 nursing home facilities, where nearly 3,400 residents died of COVID-19, there are no publicly available records of any fines imposed by the state for COVID-19 related violations. In fact, according to these records, between March 2020 and February 2021, citations were issued for only 34 residents related to COVID-19. The average fine was just $2,885. We needed stronger oversight and accountability during the pandemic. Finally, staffing levels matter. Nursing homes that reported staffing shortages had far more COVID-19 cases than COVID-19 deaths. The state must make the financial investments necessary to improve compensation, benefits, and staffing levels. There's been a long-standing staffing crisis due to inadequate compensation. The pandemic only made things worse. We believe that Senate Bill 1030, which mandates higher staffing ratios, will be a significant first step in the right direction. In conclusion, this report shows that nursing home staff offer an essential perspective on the crisis in nursing homes. The state has a responsibility to ensure that nursing home workers are paid a livable wage with good benefits and affordable health insurance. We hope that this report offers the public a deeper understanding of what nursing home workers went through, and we hope that it moves us toward long-term solutions to this crisis. Thank you very much.
Thank you, Aaron. Okay, we're going to open it up for questions now. I would invite people, if you can, to use the raise hand function in Zoom. Let's all try to be patient with each other as we manage this. Also, I've put a link to the report online in the chat. That was an earlier question. So it's online now and available to everybody. And I apologize to show my ignorance. I don't know your full name, Kay Phaneuf, but we'll start with you, and then John Craven will be second.
Thanks. Appreciate it, Professor Wishney. This is Keith Phaneuf with the Connecticut Mirror. You got the last name, that's what counts. So I did want to ask if I could start with the legislators. I hate to boil anything down to one issue, but to a large extent, this is a point of contention between OPM and 1199 and Governor Lamont's philosophy that we should only be responding to this crisis with federal dollars despite huge reserves and a huge surplus. What, if anything, can the legislature do, and specifically the Democratic majority, to tip the balance? Because everybody's being very polite, but we all know where the challenge lies. And then after that, if possible, I had one other follow-up question.
Okay, thank you for that, Keith. So maybe we'll start with Senator Anwar and then Senator Cabrera.
Thank you so much. Thank you, Keith. I think that's a very important issue, because the federal dollars are just for an urgent use right now. And we have a chronic problem. And then we have to have a long-term strategy to try and address the challenges. And I think that's where there is look at a long-term strategy rather than a band-aid fix that we are being suggested. And I think that's what we address and look at. And again, this report highlights the need for that. It confirms the only way to react to this is through legislation, but also through the executive branch recognizing that we have to have a long-term strategy. I hope this answers your question to some degree.
Thank you. Senator Cabrera, did you want to comment?
Yes, thank you so much. I know there's conversations, and we're going to continue to have conversations with the administration. You know, one of my concerns is that while we have plenty of revenue coming into the state, we all know that we have excess surplus. We all know the rainy day fund is filled to the brim, and we know we're getting a lot of ARP funds. We need to really have some long-term thinking here. And while it is great that we're getting the level of funding that we're getting because of this pandemic, the reality is that in the out years, we're kind of going to be right back where we were before the pandemic, because we haven't addressed revenue, structural, in terms of the underlying structural issues that we have in Connecticut. So that's what I'm looking at in the long run. In the short term, we need to do the right thing by these workers who have been in the trenches and on the front lines in the very beginning. So I'm hopeful, and we're going to continue to have those conversations, as you know, as we head into the June 9th adjournment, and continue to have those conversations. In the meantime, I want to make sure that these workers know that we are here as partners of them, that we recognize the work they're doing, recognize the risk they've taken, we recognize the pain and the suffering that they all have been through. And I think we have, I know we do, have an obligation to make sure that we not just address the issues we're confronted with right now in the immediate term, but also to begin to think long term, to make sure that we have the revenue and the support that we need to make sure that, God forbid, something like this ever happens again, that we have the structures in place to make sure that they're supported.
Thank you. Just one quick follow for Jesse Martin and Professor Wishning, just for the purposes of full disclosure. On the website, it says that the 1199 quote, retain the worker and immigrant rights advocacy clinic. Was this study done pro bono, or did the union make some type of contribution, or was there a contractual payment? And could you just clarify in specific dollar amounts how this study was arranged?
I can answer part of that, and then I'll let Jesse do the rest. There was no payment here. These were legal services provided without fee, without compensation. As with all of our clinic matters, we represent clients on a pro bono basis.
And there was no contribution, like a charitable contribution made or anything like that?
No, my dean will be disappointed to learn that there was no contribution whatsoever.
Thank you.
Okay, Jesse, I don't know if you wanted to add anything to that.
No, I think you covered it.
Okay, thank you for the questions. I think John Craven was next, and then Amelia.
Hi, everybody. Thanks. Just a couple of quick questions. You know, whenever you talk to the governor's office about this, they're very quick to point out that, you know, we've raised the Medicaid reimbursement multiple times. I think the study points out 20% in total. Yeah, I mean, they're going to say at some point that the nursing homes themselves have to step up and just start paying more. What would you guys say to that?
Well, I'll respond. You know, the vast majority of nursing homes in this state, the revenues come from Medicaid. And in particular, 1199 represents some of the highest Medicaid level nursing homes in the state, particularly in urban areas. New Haven, Hartford, Bridgeport, some nursing homes average 99% of their residents pay for their care at the nursing home through Medicaid. Temporary Medicaid increases have been allowed, as the study finds, and you can obviously ask OPM and DSS, these temporary rate increases have been used for lots of things. A very small portion, and I think the governor admitted this in a statement just in the last few days. A small portion of that money has gone to workers. A much larger portion has gone to buying high-cost PPE that jumped 1,000, 2,000%. A larger portion of the Medicaid increases went to other programs approved by OPM and DSS for nursing homes. We are talking about what this study concludes is that structural change needs to happen in the Medicaid system, and we need to sustain that not with Band-Aids, but with real fixes. You don't lift someone out of poverty because you gave them a one-time bonus. You lift them out of poverty by allowing them to afford to feed, clothe, and care for their children. If I am a CNA, like so many other CNAs in the state that work 4 jobs, that means I'm not going to parent-teacher conferences. That means I'm not there to help my kid do their homework. That gives the quality to our communities, and that is the difference between having structural change and a Band-Aid. Temporary Medicaid increases are Band-Aids. And in particular, many of those Band-Aids have not been earmarked for the purposes of permanent wage increases or benefit changes for these nursing home workers. And in particular, none, from my understanding, of the Medicaid increases have been used to increase the number of staff at the nursing home, which this study concludes was there was a high correlation between low staffing or bad staffing and resident infection rates and resident deaths.
Thanks, Jesse. I just have 2 strike questions for you real quick. You mentioned a few minutes ago that strike notices are going out to 6 additional facilities today. Can you tell us which ones they are and how many workers that affects? And also, do you guys have any plans do you have any more details about what this week's strike could look like? Is it going to be just 1 or 2 days? Are we talking about weeks?
So later today, we will send out a press release with the addresses and names of those employers of the additional strike notices. But those additional strike notices will cover over 600 additional nursing home workers. We are, for our strike that's scheduled on May 14th at 6 a.m., we are going to last as long as necessary out on strike. We're planning to be out on strike as long as it is necessary for the governor and for the nursing home employers to understand that these workers need to be lifted out of poverty. They need to be treated with dignity, and the nursing home residents need to have the staff to care for them in the proper way. So
Jesse, what happens in the facilities if the workers go on strike? I mean, are they allowed to bring in temporary workers to make sure that the residents are cared for? How does that work?
Yes, nursing home companies and the state of Connecticut must figure out replacement workers.
Okay, thank you. I think next was Amelia Adi. I apologize on the last name again. My last name gets butchered all the time. I'm sorry to do it to you too, but Amelia, and then I think Lisa Backus was next.
Thanks. No, you can call me whatever you want. Yeah, so this question, I guess this would be for Jesse. I was looking at the report. I saw that there were a very low number of citations, obviously. But the other thing that the report points out is that the citations that were issued really don't have any correlations between the DPH fines and the number of deaths at the facility. So I guess my question would be, since one of the things that's being asked for is an increase in DPH oversight, how do you square that with the fact that it looks like the oversight that's been provided really hasn't been accurate, or it looks like there almost needs to be a change in the way the oversight itself is working? Do you have thoughts on that?
Yeah, I think it's both. DPH needs to staff up. They shut down in-person surveys for almost a 2-month period when COVID was at its height in these nursing homes. And they relied on FaceTiming administrators or phone calls to the nursing homes to see what was going on. And that just wasn't effective. And then to go to your second question, does there need to be a systemic change in oversight? Absolutely. This report very clearly shows that there are plenty of data sets that the Department of Public Health has access to, but have not used to track trends between employers, between regions, between common workplace issues or infection control procedures. I'll give one example. Very important in nursing homes is cohorting. So having residents of the same COVID status being grouped together, separate from, let's say, COVID positive residents, separate from COVID negative residents. Well, there was a lot of confusion in the Department of Public Health in guidance to that to nursing home operators, and very little follow through when it came to actually holding operators accountable to cohorting policies. But on top of it, cohorting doesn't work if you don't have enough CNAs to work separately with the COVID positive residents and a different group of workers to work with the COVID negative residents. Because these nursing homes saw tremendous staffing crisis and no direct support from the Department of Public Health around that, like other states did. Massachusetts brought in the National Guard to help when a facility was low staff. Connecticut didn't. Connecticut did nothing. So now you have the residents separated, but you still have one CNA taking care of all those residents. It just doesn't work. So to answer your question, you need both things. You need an investment in actually having enough oversight on the ground to keep these facilities on where they need to be kept, on infection control procedures, but you also need a change in overall programming and strategy from the department's commissioner.
Okay.
I will just add a couple of sentences to this as well. In my conversation with some of the workers who had complained, when the nursing home was evaluated by Department of Public Health, it was not an in-person evaluation, and the conversation was only with the administration. And if there was any worker involved, they were in the presence of the administration. And that actually just has an impact. For evaluating the quality and the concerns, you need a new system and a better system for independent assessment, and it has to be in person. And I think that's why you need more resources for the DPH to do what they need to, but also have a different structure for assessment as well, because this clearly failed.
Thank you. And just one other question. Where do you think that the lifting of the liability for nursing homes by the governor's executive order has impacted these concerns?
Jesse, do you want to respond on that?
Sure. I think we've yet to really see how that is going to impact our concerns around oversight. I think it's a wait and see approach. Not all states in this country gave nursing homes the executive order that the governor gave to give them the lack of oversight by families. I personally have family that are residents in a nursing home, and I can speak from personal experience how frustrating it is not to see them for a year and to feel out of touch with what they're going through. And I guess we'll wait and see.
I will add something because I may have a little bit more luxury on speaking on this as well. If you take away the legal immunity, if you take away the family's presence to see and then be the advocate for their loved ones, and if you actually also reduce the number of workers, this is what's going to happen. You will have exponential number of increased deaths that you see, and there will be no recourse either. So this is not a good idea, and this actually harmed our citizens. And going forward, we need to have long-term strategy of how not to do this again.
Thank you.
Thank you. Lisa Backus, and then Nicole Leonard is next.
Hi, good morning and or afternoon, everyone. My question is for Aaron. Can you do me a favor and go back through the analysis? I guess let me start with by publicly available documents. So what you were going through were the documents that were posted on the DPH, the inspection reports. Where did you get your documentation?
Yeah, we combed the Connecticut Department of Public Health website on their e-license website, where they post all of their documents, whether that's citations, inspection reports, or statements of deficiencies. We spoke to different Department of Public Health officials saying that this website should reflect all their publicly available fines and documents. They were talking about how their website has some faults, but this should update and reflect everything that they have on that. Yeah.
Okay. Okay, I'm sorry, I didn't mean to cut you off. So you believe you were looking at everything that they did that was supposed to be posted. So, all right, so that's number one. But number two, can you go back over a little bit the findings? So you found that the 12 nursing homes who had the highest number of people who died, residents who died, they actually got no fines, no citations. That is correct?
Yes, that is correct.
Wow. And you mentioned the 170 figure. There were 170 that got absolutely no fines or no citations whatsoever as related to the pandemic?
Not that we know of, and not that anyone anyone outside of Department of Public Health knows of.
Wow. And they have they inspected, or did they inspect all, it was 200 and some odd homes. Was there some type of inspection, whether it was in person or by phone or by Facebook Live or whatever? Each and every single one of them, all 200 and something?
We don't know affirmatively whether they inspected every single home or not.
Okay. All right. Thank you very much, everyone. I'm done.
Thank you. Go ahead, Aaron.
Just on methodology, we would refer everyone to the methodology section of the report that goes into detail about some inconsistencies that may result from the DPH side on their updating process to their website. But we combed through everything that they had available.
Great. Okay. Nicole Leonard.
Hi, everyone. Thanks for being here. My question had, in one part of the report, it had mentioned hazard pay and some of the varied hazard pay rates that differed between nursing homes. And I was wondering, does anyone know in regard to that, and I'm only assuming, but I think some people have been calling it hero pay. I think that's what we're talking about as well, right? Hazard pay and hero pay. Was this money that was coming in from federal aid to some of the nursing homes that was specifically supposed to be for hazard pay? And why are we seeing such discrepancy in the different nursing homes and the different rates? I think one example was $2 was paid for every bonus hour out for one person, but it could have been significantly less depending on someone's position. So I don't know if anyone has any more details about that.
So I could talk a little bit about that. There was no minimum requirement for hero pay for nursing home workers in the state. nursing home could use, could give them 50 cents, could give them $2, could give them $9 an hour. The nursing homes were allowed to put tons of caveats. So if a worker showed up 1 minute late, they therefore forfeited their hero pay for a month or for a week. Or in some cases, in some non-union nursing homes, if they got sick with COVID, they forfeited their hero pay for a week or a month. Little to no oversight by the Department of Social Services, which is the group that oversees the economic portion of the nursing home industry. And a lot of the temporary Medicaid increases were financed almost entirely with federal dollars. And there were some programs where the state of Connecticut said you should use some of this for hazard pay, but again, they set no standards. They didn't enforce any standards, and they let the operators pick and choose who they give money to.
No, thanks for clearing that up. And my other question was, and I don't know if Tanya is still on the call, she might not be, but for any for workers that were experiencing that had to go through using sick time during their working hours, I was wondering, I've heard from a couple of people who actually reported that after they had used sick time and other paid time off, that they actually wound up owing their employers money because that's how their paid sick time worked, that if they had to take more because they got COVID on the job, they actually wound up owing their employers money for their sick time because they got sick on the job. So I was wondering, I know there are different cases in different circumstances, but I was wondering what sort of things, issues that workers have run into here and what possible solutions there are for better paid time off in situations like this.
So I'll speak to that as well. Yes, workers became indentured to their employers. Workers who got sick, who were out for extended periods of time or even short periods of time, were required to use their own sick time, their own vacation. Many workers went into the negative if their employer allowed them to. I have some members that are represented by the union that are still paying off what they owe to their employers. And that's also partly the issue of workman's comp. Workman's compensation has only been awarded to nursing home workers that tested positive from the beginning of March through the middle of June of 2020. But as the report shows, there were significant outbreaks across the state in the summer, in the fall, and particularly in the winter. And we had thousands of members out sick who have still denied workman's comp claims from their employers. When they took care of 100 residents with COVID in their nursing home, their employers have said, we don't know if you caught it here, maybe you caught it at the gas station. And so workers had, because this workforce also lives in poverty, there's no buffer in their economic world to be able to deal with not getting paid. And a lot of people have been long-term economic damage to their relationship with their employers and to their own households because of being sick with COVID, because they walked into work, because they weren't given masks or weren't given PPE or made to work in trash bags or not enough staff. They then became indentured to their employers.
I think you're right, Nicole, that Tanya is no longer on the call. Glenn, I don't know if you wanted to add anything on that. I had a little trouble with the connection, Glenn, when you spoke earlier, but if you're still here and wanted to add anything, I would invite you in. If not, we'll go on to the next question from Dave Collins.
Glenn, it may help if you turn your video off.
Sure, I'd like to add something.
Great, please do.
It may.
How's that, any better?
We'll find out.
I had an experience with workers' comp. I did catch COVID in my job. I was out 6 weeks. It took them 2 weeks to pay me the first time. After that, 3 weeks later, I had to call them. They said that I should immediately get a test if they're negative. They came back negative. They told me to go back to work immediately. And I took an additional week off without pay because, like I say, I still had symptoms. I just didn't feel right about going back to work. I was coughing. You know, I couldn't even fill out the paper to get into the building. It was absolutely ridiculous that I had to lose a week's pay as soon as I got tested negative, even though I still had symptoms. That's what
Okay, thank you, Glenn. Next question is Dave Collins. Dave.
Good morning, everyone. I had a couple questions for Jesse about the status of any negotiations going on right now to talk about the strike, and also about problems in the nursing homes still going on right now with, you know, there's still shortages of PPE, and I don't know if you could further, you know, talk about the staffing shortages we have right now.
Sure. Yes, we are still at the negotiating table with the companies that have the upcoming strike deadline, and we'll see where they lead. Again, without additional funding allocated, in particular earmarked for wages and benefits of workers, I think that our negotiations are going to be difficult, to say the least, and impossible to say the most. There are spotty supply shortages. You know, the state says that the supply chain has come back somewhat. Yes, the prices have come down, but there's still a lot of shortages. You know, in the last week, I had several nursing homes report to me that they had COVID positive residents, and the only soap that they had at the nursing home was shampoo. They didn't have hand sanitizer, they didn't have hand soap, and there are supply shortages. You know, whether that is a funding issue or an issue where the operator is not doing what they need to do as an operator, I'm not clear on, but there are still problems that exist out there. And in particular, the hoarding of PPE by supervisors in the management of facilities, which is addressed in the report, is still a concern. Workers come into work and have to argue with the supervisor about getting a clean mask each day. Or in some cases, they're being asked to take the PPE home that is soiled and clean it at their home, which is just, I don't know, beyond insulting, but also degrading to the quality of care that the residents deserve. And staffing is a tremendously terrible situation right now. This crisis has been on the evening news every day for over a year. To attract people to come and work in a nursing home, you have to pay people a dignified wage and benefits. Otherwise, you are not going to get people to come and risk their lives and the lives of their children and their family to do this work. Cna Work, certified nursing assistants, make up the majority of workers in a nursing home. They have the most dangerous job in the United States. 1,700 CNAs have died in this country from COVID they caught at work. It's backbreaking labor. Just in the last 24 hours, I've received reports of many facilities working with dangerous staffing levels. On one CNA taking care of over 20 residents on day shift. It's just impossible to expect quality care in that type of circumstance. This is a tragedy waiting to get worse right now.
Okay, Dave, I didn't know if you had a follow-up question.
Yeah, I just had one or two follow-up questions for Jesse. Are staffing levels below regulated minimums right now, and what can regulators do? Is there anything regulators can do to order nursing homes to increase it if they're not meeting the minimum staffing levels?
The minimum staffing levels in this state are archaic. They haven't been changed for 4 or 5 decades. Under the state's minimum staffing, which only requires a certain number of hours to be worked by LPNs and RNs, not CNAs. One of the policy recommendations in this report, as Aaron laid out, is to pass Senate Bill 1030, which would require a much more robust minimum staffing requirement. And in particular, that staffing requirement in Senate Bill 1030 is recommended by the federal government and has a minimum staffing requirement for CNAs, which are the hands-on caregivers in the nursing home. That is really what's necessary. Now, in that legislation, you can't expect people to hire people at poverty level wages enough to meet those demands, but also you're going to need enough money in the system to hire more people than what's currently allowed under the current system. So really the question is, does the state prioritize this industry in long-term care and invest in it? When you pay workers more money, they spend it in our communities. It's a plus for our economy. And in particular, if you get nursing homes to hire more staff to meet those minimum staffing requirements, you're putting more people to work. And so, this is an investment in the long-term solutions to long-term care, but also an investment in our economy.
I can add a couple of things as well to the bill. Again, it's section 13 in the bill 1030, Senate bill. And then it actually does require for the first time to look at our direct care from nursing assistants, but also asks requirement for social workers and recreational staff to be part of the team. Again, this is very centric towards providing better care to our nursing home residents, but making sure they're protected physically, but also there's an emotional and social component that would be addressed in this.
Thank you, Senator. Dave, I couldn't tell if you were starting to ask another question.
Maybe I just wanted to ask Jesse just one more quick question about whether the nursing home companies or management have actually offered any wage or benefit increases, or if they have been too low. Is that why that's the sticking point?
So have nursing homes proposed benefit and wage increases in our current negotiations? Is that the question? I couldn't hear you.
I wonder if they've made it, if you've asked them for wage and benefit increases, and I'm just wondering if they've made you some kind of offer that maybe not, is good enough for you guys. Well,
so I'll go back to the minimum wage in the state of Connecticut right now is $12. It's going to go to $13 this coming August. July of 2022, it'll go to 14, and June of 2023, it'll go to $15 an hour. We got wage proposals that don't even meet those minimum wage increases that way. So negotiations become a lot easier and a lot more simple, and really move workers out of poverty when the state invests in this system through Medicaid. That has been the case for years, and that will continue to be the case. And this study shows that there's a correlation between how the state funds this industry and regulates it to the impact on human lives. So, some employers have provided wage proposals, some haven't.
Okay, well, thank you all. I think we'll close it then. Thank you all for participating, for the speakers, for the participants, and for members of the press who attended. We appreciate it very much. We'll close this out now. Thank you all.